Okay, this is part three of a knee injury, complete tear of the meniscus. Part three. Um, okay, I believe I left off where, as I was coming to after the actual surgery, the nurses woke me up out of, or greeted me when I came out of the anesthesia. And the surgery was over, and everything was good to go. Um, like I said, they give you some food and they give you some drink, and you kind of just for about 20 minutes they want to make sure you're okay, make sure you know you're good to go, you're good to walk, you're good to walk out of there. You know that you've come to fully, completely come to, and then they release you, they let you go. Of course, they take your IV out, and they allowed you to get dressed and all this good stuff, and they send you on your way. They want to make sure you're okay first. Like I was saying with my surgery that I had was the partial medial um, meniscectomy, and it was a complete success. I have nothing but praise for the doctors who worked on me, the surgeons who worked on me, the nurses, any of the staff member that was involved today at the surgical center in St. Vincent's, and that's in Erie, Pennsylvania, St. Vincent's Hospital, and I believe they're a member of um, Allegheny Health. So hats off to them, man. Uh, Great job today. A special shout out to Dr. Daimel. His name is Dr. Daimel. He's a orthopedic surgeon, and he's located in Erie, Pennsylvania. And all I can say about him is super, 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 super duper. Great, great, great surgeon, and I'm very pleased, happy to have been referred to them. And like I said, everyone in their office was great. Even not even, I'm not, but as well as the physician's assistants. Her name is Dr. Maloney, and she was great also. She was the physician assistant who initially assessed me when I walked into their office for the first time. She's the one who ordered the MRI, and she was great as well. So, hats off to that whole staff, to the orthopedic office there. It's in the Hardner building, and it's right behind St. Vincent Hospital. Um, it's just a great, 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 great experience I had. So, ordered to see Dr. Diamond on Friday, which is 3 days from my surgery, and he's going to take the dressing off and redress the wound, and probably go over rehabilitation measures. Either there's going to be a rehab specialist that's going to go over it with me, or he's going to, refer me to one or whatnot, or like kind of give me some advice on how to rehab it himself. I'm sure he can give me advice himself. So I'll start on that once the swelling goes down, and once it's good to go to start rehabbing it. I'll start on that, and I'll be very vigilant about it. I'll do it correctly. I'll do it as I'm told, and because I want this to be 100% healthy as soon as possible. And I'm not going to overdo it, of course, but I'll do exactly what they tell me. And 3 weeks from now, I'll have the stitches removed. The sutures will be taken out. So, and that's on May 21st. So everything's looking good to go, so far. So now what I want to get into here is show you kind of give you a brief, and you can do this yourself if you go on YouTube. And all you got to do is type in arthroscopic knee surgery, meniscus surgery performed. You type in those exact words, and I'll give you a close-up of it right here. I don't know if you can see that. My phone's kind of... But it's the video right in the middle I'm showing. Again, I'll say it. Arthroscopic knee surgery, meniscus surgery performed. Type that in, and you'll get this video that I'm looking at right now. And that'll give you a good idea of what they're basically going to do to you while you are out. They're going to repair your meniscus. Fix it. They're going to fix it. You know what I mean? So, there's different types of this too. There's where they cut the loose hanging parts out, right? So that basically smooths it out and enables you to get full range of motion again. Allows you to get full range of motion and use of your leg again. It allows you to walk again, of course. It allows you to do everything you did in the past. The only downside to that is they're taking away part of the cushion. They're taking away part of the meniscus. And when they take away from something, it obviously is not going to be as strong as it was initially. So the downside to that is going to be arthritis, potential arthritis in the knee, because that means that the knee, the joint don't have the cushion that it naturally should have. So it's going to be harder on the actual bone that's being cushioned in the first place. But anyway, the other type of surgery that is performed is when they can actually repair a meniscus, meaning they're not taking anything away from it. They are actually suturing or putting back together the meniscus. However they do that. But in that case, it's a more, I believe, don't quote me on this, I believe it's more of a involved, detailed surgery. It's maybe more difficult. Maybe it takes longer. And I know this for a fact. I know that the healing process is much longer for that type of surgery. Like, you're not going to be back on your feet for like at least 4 months with that type of surgery. But anyway, I'm getting the surgery that is the partial medial meniscectomy, meaning I'm getting mine. My meniscus is torn, it's hanging, and it's getting taken off. It's getting cut off. You know, they're not repairing it. They're taking away. They're fixing it by cutting it off, by cutting off the loose ends, so to speak. So, but anyway, my projected heal time is like 1 month to 6 weeks. So I like that. That's good music to my ears. It means I can get back to full walking ability within a month, you know, and maybe back to work within a month. We'll see, 6 weeks. But anyway, I want to show little bits and pieces of this video just to give you an idea what they're going to do while you are under anesthesia, while you are out. So bear with me. Okay, I'm going to fast forward to this first part. I just want to get to the part where they actually are doing the work. Just to give you an idea. And you can watch it on your own, like I said. I don't want to be copyrighted, so I'm not going to watch this whole video. Just bits and pieces. And they're showing you right here, they're showing you, I know I'm speaking over the doctor, but you can watch it on your own if you want to. But basically, in a nutshell, they're showing you how they are taking away from the loose hanging meniscus. See how it's frayed right there? It's frayed. So they're going to cut that out. They're going to edge around that area to make it nice and smooth. And get it back to working order, get it back to what it was meant to be, you know what I'm saying? So they need to cut all that frayed area out, and what they do is they use a cutter specialized cutter that has a suction to it too. So there's actually, as they're cutting, it's being sucked out. So none of that's going to be like floating around in your knee. So don't worry about none of that. None of that loose meniscus that you see there. It's not going to be floating around in your knees. It's being sucked out. So that gives you a basic idea of what they're going to do. Like I said, you can watch this video on your own when you have the time. I just kind of wanted to use that as a reference for you guys to go check out a good video on what the actual doctor does and performs. So if you're getting this type of surgery done. Yeah, man, I mean, look, it's not bad. You know, it's one of those things to where I was kind of how do you want to say it? I was a little, I was a little worried as I was going in earlier today, because I've never had surgery in my life. I was never put under. I've never had anesthesia, so I didn't really know what I was getting into. And they made me feel very comfortable. They explained everything to me in detail, very educational, tell me what was going to happen, why they had to do this, why they had to do that. And they walked me through every little step. So, and then before I knew it, I was out. Like, she was explaining to me, it's going to feel cold. And then bam, as soon as she said this is going to feel cold, meaning the sensation of the medication that she was giving me via the IV. Once she put that in the IV, now this medication that was running through the IV into my arm had a colder feel to it. And that's when she said it's going to feel cold here. And as soon as she said it's going to feel cold, I was out. I just, boom, all of a sudden I remember waking up was all after that. So, yeah, everything worked out fine. Everything, looking forward to this this healing process. So with that being said, I'm gonna end this video here, and I hope I brought comfort to somebody. I know that I wasn't the best in describing in my how do you want to say it? Say, there you go. And my articulation is not too good. I'm not very articulate with my words. I have to think of what I'm saying, and sometimes it takes too long to think of what I want to say. But hopefully you get the message. Hopefully you get the hint, the gist of what I'm trying to say. And yeah, I mean, I hope I made it life easier for you, and that's the reason I'm doing this video. Okay, I'm out.